You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12.
Good morning, doctor.
Good morning. Please, be seated. May I know your problem?
Well, I feel that I have jaundice and a pancreatic mass. And recently I've noticed a new murmur, bacteremia, and fever.
What's your age?
64, doctor.
Okay. Do you have a cardiac history, or else any shortness of breath called orthopnea, or attacks of severe shortness of breath and coughing at night called paroxysmal nocturnal dyspnea?
No, doctor.
Are you getting chest pain, palpitations, or syncope?
No, doctor.
You have any past medical history?
I had diabetes, hypertension, and transient ischemic attack long back.
Okay. What medications are you taking?
Acidophilus supplement, cholestyramine, Creon 20 3 times daily, Diovan 160 milligrams twice daily, Lantus 10 daily, Norvasc 5 milligrams daily, Novolog 70/30 10 units at noon daily, Pamelor 15 milliliters every evening, vitamin D3 1 tablet weekly.
Are you allergic to any medication?
I'm allergic to codeine, Coreg, and vancomycin.
Is there any family history of illness?
While my daughter has a history of a murmur, my father died when he was 75 due to chronic heart failure.
Okay. Well, your laboratory data shows sodium 133, potassium 2.8, chloride 99, bicarbonate 31, glucose 75, BUN 12, creatinine 0.8, calcium 8.6, total bilirubin 3.2, AST 63, and ALT 43, white count 5.4, hemoglobin 9.1, hematocrit 26.6, and platelet count 128,000, lipase less than 10. Your abdomen CT diagnosis shows a pancreatic mass with biliary obstruction. Previous biliary stent is present. Your electrocardiogram shows normal sinus rhythm. There are no acute ST-T changes. Your temperature is 98.8, heart rate 96, sinus blood pressure 138/55, respiratory rate 20, and oxygen saturation 92%. You have newly developed murmur that has occurred in the setting of fever and bacteremia. You also have a pancreatic mass with jaundice, hypertension, hyponatremia, and hypokalemia. Take Diovan and Norvasc for blood pressure control. I recommend that you should undergo an echocardiogram. This will be to assess the possibility of endocarditis, which may be contributing to these symptoms.
Extract 2. Questions 13 to 24.
Good morning, doctor.
Good morning. Please be seated. May I ask why you have come to see me?
Well, I have had a sudden onset of pain by lifting a weight of about 40 pounds at my workplace. I have developed pain on my left hip. Although the pain is dull, it is aching and stabbing. The severity ranges from mild to severe. The pain is present constantly and worsens while sitting, twisting, lifting, or riding in a car. The pain improves after resting. Sleep alteration due to pain is positive, and I wake up after getting to sleep. I'm feeling depressed all the time due to this persistent pain and have lost my interest in all activities. I get insomnia, lack of concentration, fatigue, and loss of energy.
Do you have pain on your spine?
Yes, doctor.
Your age?
48, doctor.
Are you attending your work?
No, doctor, I am not going to work.
Have you been immunized before?
Yes, doctor. I had flu vaccine 2 years ago and pneumonia vaccine 5 years ago.
Do any of your family members have a history of illness?
My father is 79 and had a cerebrovascular stroke and hypertension. My mother had a congestive history of heart failure and died at the age of 70.
Tell me if you have any past medical history.
I had an appendectomy 7 years ago and a cholecystectomy 3 years ago.
Do you drink or smoke?
I used to smoke before, but I have stopped smoking nowadays, and I drink socially.
What medications are you taking now?
I am taking Lortab 10 milligrams whenever I get pain.
Are you allergic to any medication?
No, doctor.
Well, your MRI shows small central herniated nucleus pulposus at L4/5, bulge at L3/4. There is a shallow left parasag, herniated nucleus pulposus at L5/S1. There is an entrapment of the superior gluteal nerve in the aponeurosis of the gluteus medius left, and you are also suffering with depression and sleep disorder. So I would recommend you take a treatment for superior gluteal nerve block left. I am going to prescribe you baclofen 10 milligrams before bedtime, flurbiprofen 100 milligrams twice a day, hydrochlorothiazide 25 milligrams once in a day, and Klonopin 0.5 milligrams before bedtime. Continue these medications for 3 weeks and meet me thereafter for a scheduled follow-up for medical management and reevaluation of your condition. Depending on your condition after 3 weeks, I will decide if any diagnostic or therapeutic intervention is required or not.
Okay, thank you, doctor.
This is the end of Part A. Now, look at Part B.